Good morning. This is Dr. Bisi Ademuyiwa. I'm a medical oncologist and I take care of women and men who have breast cancer. This is the seventh in my videos, and these videos are designed to educate the lay public about breast cancer. None of these videos is designed to replace the patient-physician relationship. So if you have breast cancer, you should be following up with a physician. So what I'd like to do today is talk about some of the common side effects of chemotherapy and how those can be managed. So the first side effect I'm talking about is hair loss or alopecia. This is very common in many patients who receive chemotherapy for really any cancers, and typically happens about the second or third week after chemotherapy is started. Can actually now be prevented by what we call a cold cap or cooling cap. This is very effective for some chemotherapy drugs, not all. And so if you think you're interested in preserving your hair, you might want to talk to your doctor about whether the cold cap is appropriate for you, particularly considering the drugs you would be receiving. The next side effect is nausea and vomiting, very common with multiple different chemotherapeutic agents. Can actually be prevented by anti-nausea medications given as prescriptions by your doctor and also given with the chemotherapy cycles. There are also some strategies such as eating small frequent meals. Ginger can also decrease the incidence of nausea and vomiting from chemotherapy. Decrease in blood counts and the potential for anemia or infections. Most patients who are receiving chemotherapy, at least for breast cancer, don't need blood transfusions, but this does happen every now and again. With regards to the risk of infection, this is when the white cells go too low. We actually have strategies now, such as booster shots, that can increase the white cells and reduce the chance of infections. With chemotherapy can cause problems with the gut, starting from the mouth. There could be taste changes. Patients do complain that food tends to now taste metallic. This does go away with time. There could also be mouth sores, and so we recommend very good oral hygiene. I usually recommend that my patients, in addition to frequent brushing, use baking soda to swish and spit to keep the mouth very clean. There could be diarrhea or constipation. Depending on what it is, you can get medications over the counter for diarrhea or constipation. There's also loss of appetite that goes along with chemotherapy. This is usually transient and improves when chemotherapy is done. I usually tell my patients to eat what they can. Again, small frequent meals are very good, and to make sure they keep very good attention to adequate fluid intake. There could be loss of menses, particularly in people who are still premenopausal. They see sometimes that they have the period stopping. This usually does come back once chemotherapy is done and can take anywhere from a few months to even up to 2 years. The younger you are, the higher the chance of you having your periods come back. The older you are and closer to menopause, the higher the chance of permanent loss of periods, so menopause. So there's fatigue that also goes along with chemotherapy. This usually tends to build up. So I tell my patients that the last couple of cycles is going to be rougher in terms of tiredness than the first couple of cycles. However, the fatigue does tend to go away when chemotherapy regimen is completed. Resting, lots and lots of fluids, and actually exercising does help manage the tiredness that goes along with chemotherapy. There is the possibility of aches and pains that can go along with certain drugs. Exercising, stretching exercises, particularly walking, lots and lots of fluids and pain medications can be given to manage this particular side effect. Patients do sometimes have changes in the skin, so dry skin, rashes, nail changes such as brittle nails, darkening of the nails, and even in very severe cases, patients can lose their nails. These tend to grow back with time when the chemotherapy regimen is completed. There are also some late side effects of chemotherapy, which thankfully are very rare but can be serious, such as the development of cancer, such as leukemia. Certain chemotherapy drugs can also cause leukemia later on. Thankfully, this is very rare and happens in only about 1 out of 1,000 patients. There's also the possibility of a weakening of the muscles of the heart, leading to congestive heart failure. Again, this can happen with certain chemotherapy drugs. Not all of them cause this. And even with those drugs, this is very, very rare. Exercising, eating healthy, good cardiovascular health, particularly with exercising, can decrease the incidence of congestive heart failure from chemotherapy. There's also chemo brain, which patients do have. So, loss of concentration or decrease in concentration, decrease in memory, either short term or long term memory. Very subtle changes, though, can happen with chemotherapy, and usually tend to happen later on in life in patients who have received chemotherapy. It's not universal, so not all patients have this, but we do see this from time to time. Sexual side effects, so vaginal dryness, decreased libido, loss of menstrual cycles, infertility can happen with chemotherapy, and there are many, many strategies to deal with this, particularly the changes, the sexual side changes that can go along with menopause, such as vaginal dryness, painful intercourse, things such as extra virgin olive oil, just putting it in there. We call it lubrication or lotion for the vagina that could help with dryness. Coconut oil can help, and if these don't help, we also give patients topical estrogens. Sometimes can help with vaginal dryness as well. There's bone loss that can happen with chemotherapy, thinning of the bones, and of course, if the bones get too thin, fractures can happen. And so we recommend good bone strengthening exercises such as lifting weights and walking, and of course, taking bone vitamins such as calcium and vitamin D to help bone health. There's also weight gain and obesity that can happen in patients who have been treated with chemotherapy. And so we advise patients again to pay very close attention to their diets and try as much as possible to reduce carbohydrates, refined, saturated sugars from the diet. And of course, exercising will help maintain good, healthy weights for patient. And so these are just some of the side effects that patients have with chemotherapy. Thankfully, 99% of the side effects go away when chemotherapy is completed. The late side effects, like I mentioned, the leukemia, heart failure, bone loss, are relatively rare and relatively unpredictable. However, exercising, keeping a active lifestyle, eating right, paying attention to cardiovascular health can decrease some of these side effects. Again, this is Dr. Bisi Ademoyewa talking just very, very briefly about some of the common side effects of chemotherapy. Thank you for listening, and I look forward to speaking again soon on another breast cancer topic.